The Weekly starts now.
15% of construction workers are dealing with drug addiction, according to the National Survey on Drug Use. That figure is significantly higher than the workforce at large and twice the rate of the general population. However, this segment of The Weekly is not going to be about the pervasiveness of this already well-documented problem. Rather, our two guests will share with you how to be prepared to address drug and alcohol use by employees at work and how to proactively help them find treatment. Specifically, we're going to talk about an initiative called the Recovery-Friendly Workplace. Joining me are Samantha Lewandowski, a recovery-friendly workplace for businesses that want to become recovery-friendly. Samantha, thank you for joining us.
Thanks for having me.
And also, we have from SBP Builders in Littleton, New Hampshire, Stan Parker, owner of SPB. Stan, thank you for joining us.
Thank you, Mike. Glad to be here.
Why don't you tell us a little bit about your company?
Okay, we're up in Littleton, New Hampshire and northern New Hampshire, and we build homes and we do additions, remodeling. We also have property management. I have about 20 employees right now.
20 employees?
Yep.
Okay. And so, why did SPP get involved in the first place with being recovery friendly? And it's a two-part question, Stan. Why did you ultimately join this initiative?
Okay. Mike, I'm in recovery myself for 12 years now. And I have been hiring people in recovery since the beginning of my business. And so I have a lot of experience in working with people who are early in recovery. And when I had heard about recovery-friendly workplace, I knew it was a perfect fit for our company. It helped create a better, I guess, focus on the culture of our company. The basic difference is if someone has a problem with addiction or alcoholism, it's an open door policy. It's not, they don't try to, if they hide it, they want to hide it because they're afraid of losing their job. But here, it's the opposite. You share it with us and we help you and we get you the help. And if you got to leave to go get help, we're holding your job for you. You've always got a job here. And if you slip, you have a problem, you come talk to us about it. And we usually notice anyways, at this point, about 2/3 of my employees are in recovery. And so everybody's looking out for each other and helping one another. And if we see someone falling by the wayside, we're on it. And we're helping them out and getting them back to where they need to be.
How does that help the retention rate for your company?
Well, it would be impossible to be at the level I am right now, the amount of business we're doing, without having people in recovery. There just isn't enough employees to go around up here. It's great to watch these people. All of a sudden, most of them are in sober homes right now. Then they get the apartment, and I've got some that have been with me for a while. They're getting their own homes. They're having kids. They've changed their whole life. They're part of the community. That part of it as well.
Samantha, from what I understand, the roots of this program started with New Hampshire Governor John Sununu. He's a ski lodge operator, and he saw a lot of employees in the restaurant hospitality industry struggling with addiction, but nobody was doing anything about it. So what happened next, and what kind of services and tools do you as an advisor for recovery-friendly workplace provide to employers?
The idea was to streamline that process and let's make it easier for people to get support, and let's make a system and a program that really works for workplaces, because work is where we reach people. We spend a ton of time there. So if we can build supports into that system, we have a high likelihood of being able to reach people where they're at. So in terms of tools and supports, we really offer quite a bit. So one of the really neat things about the initiative is that each workplace that participates gets assigned a recovery-friendly advisor. So that's what my role is. So I'm Stan's recovery-friendly advisor, so that's how the two of us are connected. And so the role of the recovery-friendly advisor is to work one-on-one with each workplace to help them develop that recovery-friendly culture. And so we do this through a variety of ways. So we help people get connected to a wide array of statewide and local resources. So some key resources that we connect to are 211 in the Doorway, providing education around those, public health networks, and also recovery community organizations. And then beyond that, we really have a conversation with workplaces to kind of figure out what direction they want to take it. And we have a checklist process that kind of structures the initiative, but then they kind of steer what that looks like internally. So some additional things that people might do, they might do like a survey to assess their readiness and their culture and kind of gauge where they're at and help them develop some priorities. Another thing that our workplaces often like to do is develop some kind of resource card. So that was started at Hypertherm. They had a resource card. It just has a key set of resources, some information on stigma, and they've had various iterations of those. But a lot of our workplaces like that idea and have adopted it and made their own resource card. Some workplaces have an EAP and they decide to kind of expand their EAP offerings or do some additional trainings or messaging around substance use disorder and what kind of supports people can access through their EAP. We also have an internal database of highly vetted resources, and we kind of curate content and a toolkit that we can connect workplaces to. And then another really key thing is having this amazing network of peer leaders that we can get workplaces connected to. So for example, Stan is such a leader in this work. If I had another person in the construction industry or the trade sign on and they were saying, you know, I'm really overwhelmed, I don't really know where to start, I would say, I have just the person to connect you with, and then I can get them connected to another peer in the field and they can have conversations around, you know, best practices and lessons learned.
You mentioned the doorway. And can you briefly explain what that is and also tie in how recovery is really a time-sensitive moment that you got to capitalize on? What is the doorway? And maybe you can begin by describing what is the experience of somebody trying to seek recovery without the doorway? Yeah,
that's a great question. So I see the 2-on-1 and doorway system kind of as two sides of the same coin. So if someone was looking for recovery supports, looking for treatment, and especially if they didn't really know where to go or they were panicked or in a pinch, they could call 2-on-1. And then 2-on-1 is operated by information referral specialists. It's an initiative of Granite United Way, but they would do, it's not like a full-on assessment, but they would ask people questions around what kind of supports they're seeking, and then they could get them connected to a doorway. And we have 9 doorways in New Hampshire, and the idea is that you're never more than an hour away from help. And so what the doorways would then do, 2-on-1 would do a warm handoff to the doorway, so they make sure that that person gets connected to an actual person. And then the doorway would do an assessment with that person to kind of determine, are they safe? How immediate of care do they need? And then work with that person to determine the best recovery plan for them, whether that be inpatient treatment or outpatient treatment or getting connected to a counselor or a variety of things. And then they're able to follow that person for a month and just make sure that their recovery plan is working for them. And if they need to go back to kind of that central hub and reevaluate or try something new or kind of determine the next chapter forward, they can do that. So prior to having something like the doorway system, people might be, so what we often find is that there's a window of motivation for people who are looking to seek recovery, or we also see that in mental health conditions as well. So there's a certain window where people are feeling like they want to take that step, and we really want to capitalize on that. We want to reduce barriers and make it as easy for people to seek help as can be. So if people are calling numbers and getting doors slammed in their face, or if they're doing these intakes where they're getting asked multiple questions, which can feel overwhelming or could feel shaming, and they have to keep going through that process again and again and again, they might end up giving up. So with the doorway will kind of take them in, do that intake process, get those questions answered, see what they have for insurance, work with them, and then they'll kind of help them navigate those options so that they can actually get into something and find something that works well for them.
Right. Stan, how do you connect with local resources to help support employees who are in recovery, or their families who are in need of recovery?
Well, here in Littleton, we have 4 men's sober homes. We got 40 beds. So that's created a really good opportunity for me. A lot of these guys are in construction. And I'm good friends with the owner of White Mountain Recovery Homes. And then we also have a recovery center, North Country Recovery Center here in Littleton, that houses a lot of meetings for these guys, a place to go and get counseling. And they also have a few other programs going on for recovery.
And Samantha, back to you. What elements need to be present for a workplace to be deemed recovery friendly? What has to happen there?
Mm-hmm. So they need to submit a letter of interest online, which kind of starts the process to get them assigned to a recovery-friendly advisor. Then we do an orientation with HR and senior leadership. So we kind of build that buy-in and let everybody know what the program is about and figure out what their needs are. Then they make a declaration to their employees stating that they're participating in the initiative and what that means for them. And right from that point, we really start seeing stigma being challenged, and that's another huge part of this work. And then they have, after they do the declaration, they get their initial recovery-friendly designation, and then they have another year to complete an additional set of components that's really focused on kind of that culture change piece and kind of going deeper with the initiative. So that includes getting information and resources out to employees to promote recovery, and it includes doing some kind of annual training on substance misuse, behavioral health, recovery, things like that. It involves getting connected to a recovery community organization. They offer peer-based recovery supports. They might choose to do an optional component of creating a recovery-friendly committee to kind of advise on what this would look like in their workplace, and then reviewing any policies that they do have around alcohol, tobacco, and other drugs. So we don't require that businesses create or change policies, but if they do have them, to review those. And if they're interested in kind of delving into that realm more, we don't write policies, but we can get them connected to some information and resources on that.
And you mentioned like language, like of course you're not going to refer to an employee in recovery as an addict or a junkie, but I noticed that you use the term substance abuse disorder, or substance use, USE disorder, rather than substance abuse. How big of a deal is language in terms of creating the culture and getting rid of the stigma?
I think language is super important. We always acknowledge that, people in recovery have autonomy to tell their story, how it works for them, how people speak in a recovery meeting might look different than how we're speaking in a workplace. But we're very aware of the way that language can influence how other people are feeling about recovery and feeling about people who have a substance use disorder. So if we use certain language, we've seen through the research, it can actually increase stigmatizing attitudes. So for the initiative, we like to present a core set of language that we invite people to use that's been shown to be less stigmatizing. So substance use disorder is an example of one of those terms.
And Stan, was language, was that you've had some examples of employees who felt comfortable enough to come to you and seek recovery help.
Yep.
Was language a big part of creating this culture? I mean, what does a recovery-friendly workplace look like to you? And was language a big part of that?
I think we're talking two different languages here. One where I call it working in the trenches, and I guess my experience isn't that language, because I'm just talking real frankly with them. Mm-hmm. And I'm saying addict or alcoholic, depending on which or both they are. But in dealing with the general public, it's a softer way of letting them know that these are the type of people that I have employed at my business. So, but it's my feeling when I'm talking with the guys, we're pretty frank about what it is and how it is, or at least with what I've been doing so far. Yeah.
Well, finally for you, Stan, I mean, what advice do you have for others in the construction industry or any business who are looking to better support employees but don't know where to start with supporting recovery? What would you say?
When I heard about this and I started to put my mind to someone who's never had to really deal with anybody with substance abuse, it's got to be a scary moment. You're getting these people's lives in your hands. And I have a background I spent a lot of time in recovery. I sponsored people, so I know what I'm getting into. So to get as much knowledge as they can.
Well,
yep.
Samantha, Stan, I want to thank you very much for sharing some really good information about this program.